Endometriosis, what you should know.
Endometriosis is a disease in which tissue that is similar to tissue that lines the uterus, called endometrial tissue, grows outside the uterus, typically within other areas of the pelvic region. It is primarily diagnosed in women of childbearing age between the ages of 25 to 40. In the United States, it affects approximately 2 to 10% of women, although many women go undiagnosed due to the difficulty in diagnosing this disease. Race has not been shown to be a factor in this disease. The cause of endometriosis is currently unknown, but researchers have determined several theories. A primary theory is called retrograde menstruation, in which endometrial cells move backwards via menstrual blood in a kind of reverse menstruation. Instead of exiting the body with menstruation, cells enter and stick to areas of the pelvic region. Some theories also suggest cell transformation. One theory suggests that cells lining the abdomen are transformed into endometrial cells due to hormone or immune issues, while another theory suggests that very young cells are transformed into endometrial cells by hormones during puberty. The most common symptoms of endometriosis are pain and infertility. Pain can occur with extreme menstrual cramps, during or after sexual intercourse, in the abdominal area, and or when using the restroom. Symptoms may also include heavy menstruation, bleeding between periods, and strong PMS symptoms. There are 4 stages of endometriosis: minimal, mild, moderate, and severe. A stage is determined by the degree to which the tissue has spread, to how many areas the tissue has spread, the amount of scar tissue, and the amount of blocking within the fallopian tubes. The intensity of endometriosis and severity of symptoms are unique to every person and do not necessarily go hand in hand. A person may have significant endometriosis with no symptoms, or little endometriosis and several symptoms. Because the endometrial tissue that enters the pelvis is similar to that which lines the uterus, it acts just as the uterus tissue does during each menstrual cycle. During a menstrual cycle, tissue in the uterus grows, breaks down, and then leaves the body via a menstrual period. In endometriosis, the tissue that enters the pelvic area has nowhere to exit and becomes stuck, causing pain. This can inflame, aggravate, and scar surrounding tissue, sometimes causing tissue and organs to stick together. If endometrial tissue affects the ovaries, cysts may form as well. Factors that may increase risk of endometriosis include having an immediate female relative with the disease, starting menstruation at an early age, heavy or long menstruation, having shorter monthly menstrual cycles, higher estrogen levels, infertility or no former pregnancy, having an abnormal uterus, reproductive disorders, and having low body fat. Becoming pregnant can actually reduce endometriosis in the body. Additional factors that may lower risk include breastfeeding, starting menstruation at a later age, and include plenty of fruit in the diet, particularly citrus. Unfortunately, the only way to diagnose endometriosis is through surgery. Although a pelvic exam, ultrasound, or MRI can help identify cysts, the only way to 100% confirm the presence of endometriosis is to view the internal abdomen directly. In a laparoscopy, which is the most common procedure used, a surgeon makes a small incision in the abdominal area and views it with an instrument called a laparoscope. A surgeon may take a biopsy to confirm the presence of endometrial tissue. Another version of the surgery is called a laparotomy, in which a slightly larger incision is made. If the damage done by the endometrial tissue is very apparent, a surgeon will remove the scar tissue during the same surgery. Other treatments can include pain medication and hormone therapy. The type of hormone therapy used is based on whether or not the patient has a desire to get pregnant or is simply trying to reduce pain. As shown in the graphic, the treatment route taken depends on the treatment goals, either reducing pain or treating infertility, and trial and error may be needed to determine which pain medications are best. In very extreme cases, a hysterectomy may be recommended, but this is becoming less common. There is no cure for endometriosis, and endometrial tissue may return after removal via surgery, so pain management is often the priority in moderate to severe cases. Living with endometriosis can cause debilitating pain that can last for years or even decades. It can affect a woman's overall well-being and her relationships with her significant other or family and friends. Depending on the medical interventions needed, it can be a heavy financial burden, particularly if repeat procedures are needed. Emotional and psychological stress can occur from both pain management and the grief and stress of infertility. Those with endometriosis can seek help from in-person and online support groups, blogs, books, mental health professionals, and organizations offering financial support.